We're going to look at ovulation charts, actually how to chart, because many women have very little idea of how their cycles work. They come certainly into my practice, thinking that they know when they ovulate, and actually once we start talking to them about their cycle, they realise that actually there's an awful lot that they need to learn. So it's really important that you as practitioners know exactly how to work with your clients. We're then going to look at, once we kind of understand how to chart, when to chart, all of the things that affect ovulation charting, we're then going to look at a series of different kinds of charts and what they might mean, how to interpret the information that's in them. So we're going to look at annovulatory charts, looking at charts that show progesterone deficiency, luteal phase defect, pregnancy, because actually you can use charts to show when your clients have actually conceived. So we're going to look at some pregnancy charts and how to interpret those, and also how to monitor for miscarriage using ovulation charting. So if you've got clients who are experiencing repeated miscarriage, this is a good way of being able to monitor what's happening for them, because maybe then some early intervention may be able to help them, and they can use this to go back to their medical practitioners. So lots of information to pack into this evening. One of the things to say is, please fire away with questions. We do have Lucia and Harriet sitting outside who'll be there answering questions for you, and we'll have a Q&A session at the end. So if they can't answer them, then we will answer them at the end. So, do fire away with questions. They're what flesh this out and make it really interesting. So before we do anything more, let's just have a little look at how to chart, because this is key. Okay. So it doesn't matter whether you are a practitioner and you're going to be delivering this information to your clients, or whether you are someone who would like to chart your own menstrual cycle. The same thing applies, all right? So you're taking your basal body temperature. So that is your temperature at its lowest level, and it means that we can measure very tiny changes. And we're talking about points of a degree changes in your temperature. Now, the thing with this is it needs to be accurate. And so for it to be accurate, we need to do a number of things. We need to take your temperature at the same time every morning. And that's before you get out of bed, eat, speak, drink, anything at all. It needs to be the first thing you do. And you need to take it under your tongue, all right? And under your tongue every single morning, not under your arm. And certainly one of the things I have heard was don't take the temperature rectally. We did have that, which caused lots of giggling actually, but yeah, the easiest way to take is under your tongue. Easy, straightforward. You must have had 3 hours sleep, because if you haven't, which means if you haven't had 3 hours sleep, you won't go into that lovely deep sleep, which means that the body temperature drops down to its lowest level. So you need to have had 3 hours sleep. If you are a shift worker, then the same applies. It doesn't matter, just take your temperature as soon as you wake up. The same thing, so before you get out of bed, eat, sleep, do any of those, eat, drink, whatever, take your temperature at its absolute lowest level as soon as you wake up. There will be changes in pattern. They are more difficult to interpret, but it will give some idea of what is happening, so it's well worth doing. Hope you can all see that a bit better. Okay, good. All right. So some of the things that you need to note when you're charting, because if there are anomalies, we will know what has caused them, are if you've had a fever. Clearly your temperature is going to be elevated. If you have an infection of some kind, and it can be any kind of infection, it doesn't have to just be a sore throat, any kind of infection, and even if it hasn't produced a fever, make a note of it, because it can affect your basal body temperature. All right. Clearly colds and sore throats will. If you've taken any drugs or medication that you're taking can have an effect, so do make a note of that. Alcohol, particularly if you've had a good few glasses, you've had a good night out, then that will show in your chart. All right, so it will tend to lower your temperature. So do make sure that you make a note of that. Smoking is key. That has an effect. So make sure that you've noted that on your chart. And either emotional or physical stress. So, say that you are someone who does a lot of exercise, or you've been through a period of emotional stress. Make a note of that, because it will help us to see where that is affecting your chart, if there are anomalies. All right. If you've been very excited, so if you've been to do something terribly exciting, or you've got something terribly exciting going on, I know these sound like strange things, but interestingly, you can see the effects that they have on charts. I'll show you some later on. Sleep disturbances, so if you wake at night, you've had nightmares, very poor sleep, maybe you've been through a period of getting quite anxious, or you've been worrying about something, make a note of that. A change in your waking time, so say that you have a bit of a lie-in over the weekend, that will certainly show in your chart, but yeah, make a note of it. Jet lag and travelling always have an effect. It's worthwhile continuing to chart if you can, because you may still be able to read the rest of the component parts of the chart, but certainly make a note of it. A change in climate, so if you're moving to a climate which is very cold, or you've gone on holiday somewhere very hot, make a note of it. Change of electric blanket, that can also have an effect. And someone did ask me the other day, she was slept with her partner who was always very hot, and she thought that was going to have an impact upon her temperature. So again, make a note of it, so if it does, we can see what might be causing the problem. Recent discontinuing of the contraceptive pill, and that's really key, because you will use that. Charting is very good at helping to identify when you start ovulating after that, so you do need to make a note on your chart to show when that happened. And also breastfeeding. If you're still breastfeeding, that will also have an effect, so do make a note of it. Okay. Alongside ovulation charting, the other pieces of information we need to gather, because it helps to build up a whole picture of what happens for you or your client when they are ovulating, is noting changes in their cervical mucus. So the majority of the time we don't produce very much, and cervical mucus is hostile to sperm. The pH is not the right pH, it's too acidic, and so sperm are killed in that environment. What we do see is around the time of ovulation, and this is key, is that cervical mucus changes. It changes its pH, so therefore it becomes sperm friendly, and it also provides nutrients and little channels for sperm to swim in. Quite an extraordinary thing. Our bodies are amazing. Some women get one-sided ovulation pain, so again they need to make a note of these things so that we can make sure that they are tying up at the right at the same time as the shift in temperature. Okay. Some women get a little episode of breast tenderness. As progesterone is being produced, they get changes in breast tenderness just around ovulation, so for them that's an ovulation sign. Okay. Some women get spotting, maybe for 24 hours they'll get a little episode of spotting, and again for them that is a sign that they're ovulating. It's usually when the follicle is rupturing, it causes a little episode of spotting. Nothing to be concerned about, as long as it ties in with when ovulation is taking place. They also get changes in levels of energy and libido. Okay, which is key. I went through a period of time where I was treating a lot of opera singers, and this is when they were at their most creative and their voice was at its best, interestingly. We found this a really fascinating process to go through, actually, because you could see as they were going through their follicular phase and heading towards ovulation, it was when they could work with their voice best of all. But when it came to producing progesterone, it changed the timbre of their voice, the voice lowered. It's really fascinating for both them and me to see that. So ovulation charts do a number of things. They help us to identify when ovulation is taking place, and in my view are much, much more reliable than ovulation predictor kits. We do have clients that like to still use them, and you will see differences, but ovulation kits are a bit one-dimensional. They tell you about rising levels of luteinizing hormone, and they don't tell you very much else. Whereas what we need to do is use ovulation charts to identify that all of the component parts of the menstrual cycle are doing what they should be doing. And ovulation predictor kits do not do that. Okay, we need to be able to make sure all of the parts are doing what they should be, and we'll explain more when we look at a chart. They help us to measure the levels of progesterone. Now that's key. It's key to maintaining a pregnancy. So if your clients have insufficient progesterone or a short luteal phase, even if an egg is fertilizing and it is trying to implant, insufficient progesterone will stop the progression of that. It will mean that there isn't sufficient time, either there isn't sufficient time for ovulation for the implanted embryo to maintain itself, or certainly it is a contributing factor in miscarriage. Ovulation charts also help us to identify anomalies in the cycle. So basically we're looking for what's happening with the bleed. Is the temperature at the right level during the follicular phase? Can we see the drop and the rise at ovulation? And is the temperature remaining high enough, therefore sufficient progesterone being produced in the luteal phase? It also is a fantastic tool for us as practitioners. So it helps us to identify for our clients exactly what is happening with their cycle. We then have structured protocols to rectify any anomalies that there may be with the cycle, so we can then use ovulation charting to measure the changes that are taking place. So it is an amazing tool to show you just how effective reflexology is at making effective changes to charting, and therefore that can be the absolute key to helping your clients get pregnant. I always find it fascinating, and I've got a lovely case study to share with you at the end. Okay, some abbreviations that you might see. One of the websites that we recommend that you either use yourself or as a practitioner suggest to your clients is a website called fertilityfriend.com. It is free to use, and your clients can then either print off charts and bring them along to show you, or they can give you their sign-in details and you can monitor what's happening with their charts. But these are some of the abbreviations that you might see. So CM, clear enough, cervical mucus. BD it stands for baby dance. It's a rather lovely way of saying that they've had sex or made love, and that's key because actually quite often clients forget that they have to have sex, or they'll have sex once a month, and if they're noting that on their chart, you can monitor that very discreetly and then suggest to them that they might need to have sex at the right time. Okay. DH is dear husband. Days post-ovulation, DPO, and when we look at the charts, you'll be able to see just how important that bit is. EDD, if they are pregnant, estimated day of delivery, so you may see that on the chart once they're pregnant. And LMP, last menstrual period. Okay, so they're all key abbreviations that you'll see. All right, so let's have a look at a chart. This is one that I use in teaching a lot because it provides lots of information. So let's just talk you through the component parts. What you'll see is the little blue dots are where your clients have entered their temperatures. So they're able to put they'll enter the temperature on their chart and it'll mark it for them. This is a fertilityfriend.com chart, okay? And what you'll see is where there are little broken lines, which you can see in various places. It's where your clients haven't taken their temperature that day. Now, if there are too many of these, it makes it difficult to interpret the chart effectively, particularly if they miss them around the time of ovulation. It means it's difficult to identify when ovulation has taken place. So they really do need to take it every day. What you will then see is this bold red line, which forms an axis, which tells you when the computer thinks ovulation has taken place. Now, if it is a broken red line, it is an estimation. And one thing to bear in mind is that this is a computer, so it isn't always right. And you may find that you disagree with the information that is on these charts, okay? But bold line means that the computer thinks ovulation has taken place, all right? What you can see is that the temperature drops slightly at ovulation, and then the moment that the corpus luteum has started producing progesterone, you see this rise in temperature. So progesterone elevates the temperature, the basal body temperature, by points of a degree. So what we're measuring is tiny increments in temperature, little points of a degree. And the temperature needs to have risen by a minimum of 3 points of a degree to show that ovulation is taking place. All right. So what you can see here is we've got a little rise, and then we've got a little drop rather, followed by a sharp rise. Okay. And then the temperature remains at a higher level, and it should stay high until the bleed starts or the day before bleed starts. What you'll also see along this red line is the number of days post-ovulation. And this is critical because we need clients to have a minimum of 10 days post-ovulation for successful implantation and therefore pregnancy. If you have clients whose temperatures are dropping too soon, and you can see here that these temperatures are starting to drop before the bleed starts, it shows that her progesterone levels are dropping, and that would have an effect on maintaining a pregnancy. So you need temperatures to be up for probably 10 days plus, and usually it's between about 12 and 16 days, the length of the luteal phase. It will be individual to each woman. Okay, so it'll be constant but individual. So if it's 12 days for your client or for you, it will always be 12 days. If it's 16 days, it will always be 16 days. It is a constant, but it needs to be greater than 10. Okay, otherwise what we have is something called luteal phase deficiency, which we're going to talk about later. All right. What you have along the bottom of the chart here is the day of the cycle. Underneath that, your clients are able to chart their cervical mucus. Okay, so we have the first 3 days on this chart is shown in red and it says menstruation. We have a little asterisk, which is a bit of spotting. These dashes mean that there's no cervical mucus produced at all. And then we have scant, cloudy, and this lovely green boxes with the E in, which stands for egg white. So around the time of ovulation, your clients should be producing more profuse, clear, stretchy, egg white looking cervical mucus. Okay, that is key, because if they're not producing that at the right time, and ideally it should be in the 2 or 3 days leading up to ovulation, then it means that the cervical mucus is hostile and therefore it's likely to be causing a problem. All right. And then we have dashes for the rest of the cycle, so nothing at all, and that's absolutely fine. It isn't necessary for there to be any. Underneath CM we have BD, which, if you remember, is baby dance. So it's a lovely, discreet way of making sure that you know when your clients are having sex, so they're getting the timing right. All right. And what we can see here is that this client managed to have baby dancing twice during the time that she was producing the correct cervical mucus, and certainly leading up to ovulation, and that's perfect. What we need are sperm in situ before ovulation takes place. All right, so good, strong, healthy sperm in the right kind of cervical mucus will survive for 72 hours to a week, actually. So better to have sperm in situ, and it stops that terrible, we've got to have sex right now scenario, because that just is ridiculously stressful, and actually usually the timing is out. So this is a great way of monitoring what's going on. What you can also see under stats are two little green boxes with dots in. Now, I don't know this is not a client of mine, but my guess is that will represent for her some ovulation signs. So it could be that she gets breast tenderness around the time of ovulation, and that's what that means, or it could be one-sided pain. It could be, her ovulation pain. But what you can also see, which is really interesting, is a little green box which says 01. And we've got this little green box here, which is on day 24 of her cycle and day 9 post-ovulation. And underneath 01 for this woman stands for sleep deprivation. And what you can see if you look on day 24, day 9 post-ovulation, is her temperature has dropped. So you can actually see the effects that sleep deprivation has had upon her cycle. Okay, so it rises slightly and then it drops right back down again. And if this were a client of mine, I would be wanting to see her temperatures up here until her bleed started. This scenario with her temperature dropping too soon certainly would have an impact upon her ability to conceive. And so we have some protocols that we use for that. They are all in the book. You will find all of the protocols on how to carry them out and how to address this particular scenario in the book, but we will touch on it briefly. So you can already see what an amazing tool this is. This tells us an awful lot about what's happening with your client's cycle. It tells us not only when she's ovulating, how long she's bleeding for, how long is her luteal phase, is her progesterone level high enough for long enough, are they having sex at the right time, is she producing the right cervical mucus at the right time, all really key to conceiving. And if there are anomalies, and we use reflexology to remedy them, you can use this as a tool to monitor the changes. Okay, so it's quite fascinating. Okay, so let's have a look at some charts, because the charts are brilliant at providing us with lots of information, as I've said already. But they all look different because they will be individual to each woman. Every woman's chart will look different, and what you're looking for is the pattern. So you're not worried so much about what the temperature is necessarily, although there are some conditions that can be a concern. But in general terms, what we're looking for is these patterns. We're looking for the drop at ovulation and then this lovely rise. You will always see fluctuations. Don't expect to see straight lines. In fact, if you do start to see straight lines, it could be there's a problem with the thermometer, and you might want to ask your clients to change their thermometer to see whether that makes a difference. Okay. So this is another ovulatory chart. What you can see is the temperature has already dropped down when her bleed starts. She bleeds for 4 days, yeah, and then it starts to climb a little, drops down, and just before ovulation, it drops down a couple of degrees, a couple of points of a degree rather, and then you get this lovely sharp climb, and then it climbs again and again. So it goes up in 3 stages, this chart, but her temperature stays right up until for 12 days post-ovulation, yeah, and then it drops down just before the day that her bleed starts. So that is perfect. That is exactly what we want to be seeing. What you can also see is she's producing some the correct kind of cervical mucus, yeah, just leading up to her cycle, which is brilliant. And you can also see that this woman has used ovulation predictor kits, and this one happens to be very accurate, and in that it's predicting ovulation, but it predicts it actually the day before. Now that works fine, because if they have sex around that time, the sperm are going to survive, but sometimes you'll see it afterwards, by which time it's too late. So it actually highlights how ineffective ovulation predictor kits are. All right. So that's a great chart that shows clear ovulation, so it's brilliant. And I just want to show you another chart which also shows ovulation, but what you can see is that it's completely different again. So really what I want you to think about is they will all be different. You're looking for patterns. Okay. So again, lots of fluctuating in the early part of the cycle. Ovulation around day 14 ties in nicely with changes in cervical mucus, and then it rises in stages, and we can see that some temperatures have been missed here, which is a bit tricky, but the temperature again stays up quite nicely, starts to drop down from about day 13, 14. All right. Now what you can see here as well is that the axis, the red lines, are broken because the computer's not absolutely sure when she ovulated, and it is relying on the changes in cervical mucus. So all of the pieces of information that are entered on the chart help the computer to decide when ovulation has taken place. But it's a good example of just a different kind of chart. And then we've got one more ovulatory chart to show you. This is a much longer cycle. So this is a 43-day cycle, which might be perfectly normal for this woman. But one of the things that it highlights is that many women, and I treat medical practitioners, nurses, I treat GPs, I treat consultants, who quite often think that ovulation takes place mid-cycle. Okay, so if they've got a long cycle, they'll think we've got a 43-day cycle here. They may think they're ovulating, around halfway through, which is, not the case. All right. They may think they're ovulating around day 20, but the luteal phase will be somewhere between 10 and 16 days, and it will be constant for that woman once you've identified when or how long the luteal phase is. So what you can see with this woman is that she had a 43-day cycle. She didn't ovulate until day 30, and that's exactly how it should be. Her luteal phase is 13 days. That's perfectly normal. But if she wasn't aware of that, she would have thought she was ovulating a lot sooner, and therefore they will have just got their timing wrong. All right? So this is just highlights how important charting your cycle is, even if you do it for a couple of months. Okay, a couple of months maybe just to see where and when things are happening may be the key to helping you conceive. All right. So again, we've got a few missed, temperatures. You can see these broken dotted lines, but very clearly we can see a little drop in temperature and then this lovely rise, and the temperature remains high and drops down just the day before bleed starts. Perfect, absolutely perfect. And lovely changes in cervical mucus around the time of ovulation. One of the things this also highlights, if you can see around days 13 to 16, this woman has charted changes in her cervical mucus that looks as though it is fertile cervical mucus, and actually they've had sex at the same time. And sometimes clients can misinterpret seminal fluid for changes in cervical mucus. So you can see that that's what's happened here. But we've got lovely sustained changes leading up to ovulation, and you can see the dip and the rise, so that confirms that ovulation has taken place. So I hope that you're starting to see just how useful these can be, either for you as a practitioner, or if you're using them to chart your own cycle. They provide you with a huge amount of information. So now we're going to look at some of the the interesting ones that show us where there are anomalies. So this is an anovulatory chart. Women sometimes think that if they are bleeding, they are ovulating, and that is not always the case. You can have bleeds, and they tend to be lighter, but it doesn't necessarily mean that you are ovulating. So the charting helps us to identify if that's an issue. This cycle was 124 days long, and there is no distinct pattern. What you can see is the temperature is just fluctuating all the way along. There is no drop and a rise. So that is an anovulatory cycle. No ovulation has taken place during that period of time, and her bleed has started. Okay, so we would need to be doing some work to ensure that ovulation has taken place. And let's just show you another anovulatory cycle. I've got a few charts here to show you. Here is another one. So it's a woman who's having a 29-day cycle. You know, a lot of women think they're having a 28-day cycle. That means all is well. But there is no clear ovulation here at all. Okay, absolutely nothing. We've just got a little peak at the end of her bleed, and then just fairly low temperatures that are fluctuating. So a good example of an anovulatory chart. And one more. Okay, a long cycle. So this was 70 days, and what you can see again is there's just no clear pattern. The temperature is just fluctuating all the way through. There's lots of other pieces of information, but they're really not of any major relevance, okay, because you can see no ovulation has taken place. So how would we work with that? We have a means of working with it, and using the charts allows you to monitor the effects that reflexology are having upon your client's cycle, which is what makes it such an extraordinary thing. It's very rare for us as reflexologists to be able to monitor exactly the effects that reflexology is having, and this is a fantastic way of doing it. And you will find all of the protocols are covered in the book with what happens, what should happen during week 1, week 2, etc. But I will just talk you through. So week 1 we use during the bleed, and we only use it during the bleed. It is mimicking exactly what the body should be doing. So it's really important. It helps us to clear out the endometrium. It helps us to clear out any debris, and of course the endometrium carries its own hormones, so it allows everything to start afresh. So week 1 is really important. And then week 2 we use, again, it mimics what should be happening with the body. We use it from the end of bleed until ovulation has taken place. So we are using lots of stimulation techniques to mimic what is happening in both the endocrine and the reproductive systems. And what we can also do with this is we can ask our clients to self-stimulate their ovary reflex points. If they are not ovulating, we ask them probably to start 3 to 4 times a day self-stimulating their ovary reflex points. I usually actually now say start, if they're not ovulating, start with 60 seconds, and if that doesn't do it, increase it to 90 seconds, okay? But you can ask your clients to monitor the changes and send you their charts between treatments. You would want to be treating them weekly, every week, using a week 2 treatment with then self-stimulating ovary reflex points in between times, and you can see the changes taking place as they go through their cycle using the ovulation charting. It's quite fascinating. Once they have ovulated, then we use what's called a week 3 treatment. We use that 5 to 7 days post-ovulation because it aids any implantation process. And then anything beyond there, the last treatment of the cycle, a week 4, is supporting any possible pregnancy. So it's very safe to use. It's very safe to use right through any early stages of pregnancy. What we do is we continue with this program until ovulation is really well established. And I've got a lovely example of that to show you at the end of the webinar. So it works very well. We have lots of our practitioners who use this and use the ovulation charting as a means of monitoring the progress using reflexology. So let's have a look at progesterone deficiency. It's another very, very common thing that we see in practice, and is something that is a factor in terms of repeated miscarriage, non-implantation, repeated early miscarriage. So you may have clients that are fertilizing eggs, but they're not able to implant effectively. So what you can see from this chart is a short luteal phase. So if you look at DPO, days post-ovulation, we only have 8 days before the temperature starts to drop down, which is not long enough, and we would want to be doing some work to improve the length of time and improve the levels of progesterone. Okay, so let's just have a look at another chart. Progesterone deficiency. What you can see here is the temperature peaks at around day 6, and then again it's dropping down. It goes up slightly on day 10 post-ovulation, but really not sufficient to sustain a pregnancy. So you can see that this is a very inconsistent chart and would be indicative of progesterone deficiency. There are lots of charts in the book, so you can kind of go through how to interpret them and also how to treat the various conditions. We have another one here. Okay, what you can see is the temperature rises again until day 8 post-ovulation, and then it just drops. So again, even though we've got ovulation taking place, lovely cervical mucus, the temperature's not staying high enough for long enough, and unless you actually chart, you won't be able to see this happening. And this could be just the very reason why your clients aren't getting pregnant. So it's such a fantastic tool. I love working with these. I read lots of them. I get clients sending these to me all the time. And I find it really fascinating watching the effects that reflexology is having. The other thing that you might come across is luteal phase defect, so very similar to progesterone deficiency, and sometimes the two cross over. But the same thing happens. You get this lovely rise, and then you can see that the temperatures drop right back down around day 6 post-ovulation. So that is really not what you want to be seeing. This client has a 28-day cycle. She would not be aware of that unless she were charting her cycle. She would not understand why she was not getting pregnant. And actually, neither would a medical professional. They tend not to use these in practice, and they really are an invaluable tool. They tell us so much. And I have many clients who are referred on for IVF, and actually when we start seeing this, you can see what the issue is, and we rectify that, and then they don't have to go down that path, which is a real blessing, because it's a terribly difficult thing to go through. Okay, so how do we treat progesterone deficiency? So we do a very similar thing. We treat during the bleed, really important, because you're clearing out again the endometrium and hormones that are held in the endometrium, so you have a lovely fresh start. Week 2 until ovulation has taken place, and then as soon as your clients have ovulated, we want to stimulate the ovary reflex point again in exactly the same way as we were when we were trying to encourage ovulation. When we were encouraging ovulation, we were encouraging follicles to develop in the ovaries. When we're working with progesterone deficiency or luteal phase defect, what we're encouraging is the corpus luteum that is left behind in the follicle once it's ruptured to produce more progesterone. So we use exactly the same process, but you would continue to stimulate from ovulation until bleed has started. Okay, and you will be able to use charts to monitor and see the temperatures maintaining themselves. They start to creep up, and fascinating for both you and your clients. So it's a great way of working. Okay, so let me just see. So monitor using basal body temperature charting. If you can't see the temperatures rising enough or maintaining themselves, you can increase the level of stimulation. So you can increase it to 4 or 5 times a day, and you can increase it to 60 or 90 seconds. It will very much depend upon what you can see in the charts. All right. But you need to use the charts really to monitor progress. It's key. Okay, so let's have a look at some pregnancy charts. What you can see here is this client has done 3 pregnancy tests. 3 pregnancy tests from on day 29, day 30 and 31 of his cycle. So the line has changed to green. But what you can see, which is really important, is that her temperature has remained high. Okay, so that is an excellent indicator for pregnancy. If your client's temperatures remain high beyond when their bleed should have started, it's a really good indicator that that they are actually pregnant, which is fantastic. Okay, and just have a look at some other charts so that you can see. Okay, here's another one. This one, 1, 2, 3, 4, 5 pregnancy tests, and you can see that her chart has changed to green. Her temperature's stayed up. All right, so really good way of charting. Brilliant. And just a couple more, I think, to show you. This one, I'm guessing, has continued to chart because she may have had a risk of miscarriage. So she has charted for a lot longer. She may have had previous miscarriages, and you can see that she's taken 4 pregnancy tests, probably just to monitor the levels of her HCG so that it maintains her pregnancy. So that takes us on very nicely to talking about miscarriage. Okay. What you can see here is, this is a very long chart, but the temperature has started to drop. And this is about it drops from day 52 post-ovulation. So if you have someone who you are treating who has repeated miscarriages, it makes sense to get them to continue charting in early pregnancy so that you can monitor what's happening. And if it is as a result of progesterone deficiency, get them to continue to self-stimulate their ovary reflex points. They can do that right up to week 12 of pregnancy because it helps to manage progesterone levels. But it means that you can refer them for early intervention if you start to see changes. Okay, another miscarriage chart. So again, what you can see is the temperature has dropped day 19, post-ovulation. Okay, day 19, and this indicates an early miscarriage. The interesting thing is about this is that you may have clients who are managing to fertilize an egg and they're creating a pregnancy, but it's not maintaining itself. So this, although it's very sad, it does provide us with lots of information because this may just as well be male factor as female. And you know, maybe that's something that we'll cover another topic, is looking at male factor issues, because they really are key. And when you're looking at causal factors for fertility issues, it's a third male, a third female and a third joint, and men are just as much a contributing factor in miscarriage as women. It all focuses on the women because we carry the baby, but it can be male factor because once the egg and the sperm has fertilised the egg, the only key part is the DNA in the sperm of the head. And if that is not functioning properly, or there's some issues with it, then it can be a factor in miscarriage. So it's really key. So I've just got another little chart. Again, you can see here that the temperatures are starting to drop before the miscarriage occurs. So at that stage you would recommend that your clients go back to see their GP for some further advice and support. Okay, so I just have a lovely little success story which is very current for me. I'm still waiting for some results. So I had a client who came to see me. she'd been taking the contraceptive pill for quite some while, but when she came to see me, she'd not had any bleeds at all for 18 months. She'd been to see her GP, who had started to refer her on for lots of investigations, and there was a long waiting list. So she really, of course, wanted to get pregnant alongside that. So this is what happened. I don't know whether you can see this very clearly, but this is a picture of her chart. And this is a paper chart that she used, okay? And what you can see here is this chart. This is only part of it. We got to day 52 and nothing was happening at all. So we continued to get her charting. What you can see is her temperatures are just fluctuating, nothing is happening at all. I think we managed to get her first bleed after about 80 days, and then we gradually reduced the increments until she had a 29-day cycle. This is the chart that she emailed to me on Monday. And what you can see is she is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. She is 15 days post-ovulation. Her luteal phase has been 12 days, so we think she is pregnant, and we are waiting for the results of her pregnancy test. But I have everything crossed for her. So that's a wonderful result. She's very nervous. She's very nervous about doing a pregnancy test. But what's been fascinating, and what I haven't been able to show you here, is all of her charts. And so each time her cycle got shorter and shorter and shorter. And then this is only her second chart, which shows a 29, or should be a 29-day cycle. And it looks as though she's managed to conceive. Okay, so that's the end. That's the end of all the information on ovulation charting. If you do want to buy a copy of the book, then Watkins are very kindly offering a 50% discount on the book, and you will get a link, an emailed link, at about 10 o'clock this evening, which allows you to do that. It means that the book's available for £25 rather than its recommended price of £50. Also in the link, in the email, there'll be a link for you to follow if you want to book a course. You'll be able to follow a link to a booking form, and you'll have a little code on there which is Web16, which allows you to book your course and receive a £20 discount on booking a course. If you need any information, then please do give me a call. My office number is 01267 290 819. And if you need to email me, then you can email through the website, which is serumnaturalfertility.co.uk. And I think what we have are some questions, which lovely Harriet, I'm just going to introduce Harriet, so if you squeeze in Harriet, lovely, yes, just introduce you to Harriet. So Harriet also teaches the course alongside me, so when you go and look at the website, you will see that some of the courses are taught by me and some of them are taught by Harriet. But I think she's got some questions from there.
Okay,
that
Barbara.
came through. Okay.
Some women are fearful of charting as they feel it may be an added pressure. How do you reassure them?
Okay. We do get some women who are concerned about charting and that they're afraid they'll become obsessive. My way of approaching it is to say that it's about information gathering. This bit isn't about getting them pregnant. It's about finding out what's happening with their chart and then remedying any anomalies. And we only get them to do it for probably 2 or 3 months maximum. All right. So hopefully that they will feel a bit more comfortable about that. Okay.
What could it mean if a woman has a consistently low temperature?
Okay, that's one of the things that we haven't actually talked about. So if you have a client or you yourself have a temperature that is consistently below 36.3 C, it could mean that you have thyroid deficiency. And the thing with this is that it can impact upon your fertility, so you would want to go and get that checked. Fertility clinics now if thyroid function, if TSH, thyroid stimulating hormone, is low, then they will supplement with thyroxine. So it's really well worth getting that checked. Thyroid function has a big impact on fertility. Okay.
And there are a lot of apps out there for charting, such as Fertility Friends, which you mentioned, and there's Clue, and there's a lot of them. Are they always accurate?
Okay. Yes, I get lots
When
of women
predicting.
who turn up with an app with just a list of temperatures on there, or a little smiley face when they're ovulating. It doesn't tell you enough. It's pretty one-dimensional. It only tells you when they think they are ovulating. So fertilityfriend.com is really key, and it provides you with all of the information that you need to have with regard to your cycle, and also for you as a practitioner in terms of monitoring and monitoring any changes. So I hope that answers that question.
So
we've got some more.
we've got a question here actually that's come up on the computer
screen,
here.
yeah.
If they aren't implanting due to progesterone deficiency,
Yeah.
they just get their bleed as normal, i.e. on their usual period start date,
Yeah.
and we only know this by looking at their chart. Is that correct?
Yes. It is correct. So basically, the only way of really identifying what's happening with progesterone levels is by looking at charts. If your clients have a progesterone test, which should be 7 days post-ovulation, not day 21 necessarily, 7 days post-ovulation, it only tells, it gives a little sort of snapshot of what progesterone is at that point in time. It doesn't tell us whether it's staying high enough for long enough. Your client may have a perfectly normal cycle. The only way of actually seeing what's happening with progesterone is by charting. So you can see what a useful tool it is. Okay.
What sort of other things, other than deprived sleep and low progesterone levels, will cause temperatures to drop, anomalies in the luteal phase?
In the luteal phase, there are lots of anomalies. So as I was saying earlier, I don't know whether you may have missed the beginning, but we were looking at all of the things that impact upon the temperature. So it could be, disturbed sleep. It could be travel. It could be sleeping in a different bed. It could be anxiety. It could be getting very excited. A whole range of things. So it's really important to note anything that is different on your chart, or you get your clients to chart, so that they can you can see what might be causing the anomalies, if there are any. Okay.
And yes, how would you manage to chart if your working hours were not consistent, such as in shift work or as an air hostess, things like that?
Yeah, so it is tricky. It is tricky, and what we do know is that changes in sleep patterns do disturb and disrupt the endocrine system and do have an effect upon fertility. But if you do continue to do it and your clients take temperatures as soon as they wake up, doesn't matter whether it's morning, afternoon or evening, there will be some kind of pattern, but it's not going to be entirely accurate. Okay.
And what is the difference between progesterone deficiency and luteal phase defects?
Okay, so a luteal phase defect is a very short luteal phase. So it means it only lasts 10 days or less. So that's the period of time from ovulation until bleed is less than 10 days. Progesterone deficiency could be that the luteal phase may be 13, 14, 15 days, but it's going up for a period of time and then it's dropping down before the bleed starts. We need it to stay up consistently.
Okay, we've got another one here. When you're getting your clients to self-stimulate, how long before you usually see a change so you can tell them to increase the self-stimulation or not?
Okay, so how do we monitor that?
How do you monitor
Well,
it?
I would, if you, what I normally do with my clients is I get them to email their chart to me, either photograph it and send it, or send their sign-in details. And if you see that the temperatures have gone up and they're self-stimulating and they just start to drop down again, then you would immediately increase that. Within a day or two of that happening, you would increase it. It's not going to do any harm to get them to increase the self-stimulation. So, yeah. Yeah, just monitor it quite closely, and quite often looking at charts every other day or so if I think there's a problem. And I also get my clients to flag it up. If they can see that their temperatures are dropping, then I get them to make contact with me, and we remedy things quite quickly. Yeah.
And is it obvious to notice that shift? I mean, when you have a 3-day shift after ovulation, is it obvious that always?
It should be obvious. You don't always get an immediate rise. Sometimes what happens is the rise goes up over 2 or 3 days. That's why it's important to look at the whole chart. It's very difficult to interpret it just in its early stages and only looking at small component parts of it. So you really need to see the whole chart first of all, so that you can identify what might be happening. Right.
Okay. Well, I don't think we've got any more questions
Okay,
now.
wonderful.
So is there
Okay.
anyone quickly want to pop one in?
No. If there's any more, type away furiously. I'm just going to go over the email that you're going to get this evening. So once you've registered, you will get another email from Lucia this evening, which will give you the links and the codes to use for the discount on the book, and also for discount on your courses if you want to book them. So look out for that later on. If you don't get one, just check your spam folders, because I know what our emails are like. They go into spam folders, so do go and check. But thank you so much for joining us, for being with us. I hope you found it interesting. If you've got any questions at all, make contact with me. You can email me via our website, which is sarahnaturalfertility.co.uk, or you can give me a call. My office number, best one to get hold of me on, is 01267 290 819. You can also look at my Facebook page, which is Reproductive Reflexology. We post loads of information on there. All the most recent pieces of research and interesting articles go on there, so just keep up to date with that if you want to. And you can also, of course, message me via that if you have anything further. But thank you very much for listening, and hopefully we'll get to do something more for you again in the future. Thanks very much. Good night now, everyone.